China, Dr. Liang Xiaofeng used to be with in a leadership position with the China CDC. He has some remarks regarding the status of hepatitis elimination in China and with a UN group of friends. This will be a recording, please.
Hello, everyone. My name is Xiaofeng Liang. I'm the chair professor of Jinan University and the vice president of Chinese Preventive Medicine Association. I would like to introduce the progress on hepatitis elimination in China. Virus hepatitis is a notifiable infectious disease in China. And we have a very heavy disease burden of hepatitis, especially for hepatitis B. Before the vaccination, higher than 10% prevalence rate of hepatitis B in whole China. And for quite a long time, we conduct many prevention and control measures for hepatitis B control. Especially, we conduct a very useful project, is the Gavi project. In this project, hepatitis B vaccine provide free for newborns in western part of China, launched in 2002. Also, the central government issued the action plan for hepatitis B prevention and control in 2006 to 2010 and 2017 to 2020. And also from the 2007 to 2020, state scientific project of the prevention and the treatment of AIDS, tuberculosis, and viral hepatitis conducted. The prevention and control hepatitis, for example, last 5 years, we use the action plan. Is the overall goal is to implement various prevention and treatment measures for viral hepatitis, curb the spread of viral hepatitis, control the rising trend of viral hepatitis, and the related liver cancer and cirrhosis deaths, gradually improve the quality of the patient to reduce social discrimination and the disease burden. We have some indicators. First one is the children hepatitis A and hepatitis B vaccine coverage rate should be higher than 95%, and the timely first dose of hepatitis B in newborn higher than 90%. The goal of the prevalence among the children under 5 years old is under 1%. And the public knowledge awareness rate is higher than 50%. And the detection rate of the hepatitis B and hepatitis C in blood should be covered by 100%. Proportion of drug maintenance treatment services higher than 70%. This picture shows the 20 years ago, we launched the project of Gavi, provide free hepatitis vaccine for western part of China. It's a successful project. You can find from this slide the vaccination rate of neonatal hepatitis B vaccine is maintained at very high level throughout the whole process and the birth dose in time. China has shifted from a high endemic area hepatitis B to a medium endemic area. We conduct a survey, sero-survey in 2014. The positive rate of the HBsAg among the children under 5 years old only 0.32%. Achieved the WHO control target ahead of the schedule. Yeah, from this slide, you can find that almost 3 decades due to the vaccination and the major policy conducted in China. You can find that before our prevalence rate of hepatitis B is very high, and our coverage of hepatitis B, especially in children, is very low. Just after the Gavi project, means from 2000 years, our coverage of hepatitis B, coverage of the hepatitis B vaccinations higher and higher, and our prevalence rate of hepatitis B surface antigen declined close to the 0.30%. Discussed many times, and our physician doctors contributed a lot. Finally, the first line anti-hepatitis B drugs have been included in the reimbursement list of medical insurance in China for whole country. The good news is the price have fallen by more than 90% since 2019. That's a very good news for our patient. And also, another good news is the hepatitis C control. We issued a very good working plan for the hepatitis C, especially also for the price of the hepatitis C, 3A, DAA combination included on the health insurance covered the whole country from January 1st, 2020. So we have a very good supply of the medicine of the hepatitis C treatment. However, China, we still have some challenges for elimination of the hepatitis. One is that we still have some very high prevalence rate of hepatitis B among the pregnant women in the southern part of China. And the annual percent change from 2015 to 2020 by provinces. You can find from this slide, this group in the southern part of China, and then one is the northeast in Qinghai, still higher than almost 9% among the pregnant women. That's a big challenge. For many indicators, just like a green bar, we have very good coverage, especially first dose of the hepatitis B vaccine. And the whole schedule coverage also very high. Blood safety is quite good. Safe injection, also syringe use for clean one, also is very high percentage. But for the diagnosed rate, only less than 25%. And the treatment for antivirus therapy used in China still very low, lower than 20%. So this part is our work field for the next step. I hope a new national plan for hepatitis elimination issued soon by new National Bureau of Disease Prevention and Control. And the prevention of the newborn infection is our top priority still. And block the mother-to-child transmission, and conduct the catch-up campaign for vaccine for adolescent and high-risk groups. Especially we need increase the diagnosed rate and the treatment rate very quickly. Also, we need early detection and early treatment for the hepatitis C. And also we need a plan for assessment for their monitoring their progress of the different provinces. Also, we need to carry out international cooperation with international communities. We will strongly support forming a group of friends for hepatitis elimination. We hope the group will be launched successfully and the WHO 2030 hepatitis elimination goal will be achieved.